morning, Mr. Thompson. I am Dr. Fisher, and these are your intern doctors. We are here to assess your health status.
Good morning, Dr. Fisher. Today we're presenting the case of Mr. J. Thompson, a 47-year-old male. He came with swelling of the feet, fatigue, and a decreased urine output. These symptoms suggest possible kidney dysfunction, so we ordered a full renal function panel.
Good. Walk me through the symptoms and the test you chose.
Mr. Thompson reported fatigue, swollen legs, and a reduced urine output. These symptoms point to a decreased kidney filtration, dehydration, or possible protein metabolism issues. Because of this, we decided the bone test was appropriate to evaluate how well his kidneys are removing urea nitrogen.
How do you prepare the patient for this test?
In terms of preparation, there is very little that the patients are required to do in order to get ready for this examination. However, their doctor should be aware of the medications that they're utilizing in order to ensure the patient's bone levels may not be lowered or elevated due to medication. Examples of medications that can alter this gentleman's bone levels are streptomycin and diuretics.
Okay, how is the test carried out?
To carry out this test, a sample of the patient's blood is taken using the following materials. These include blood collection tube, non-sterile gloves, assortment of needles and syringe of different size, alcohol and alcohol swabs, cotton balls, blood specimen labels, transportation bags, tourniquet, and a sharp container. First, double check that the patient name matches the name on the lab form. Ask the patient to extend their arm and place a clean towel or paper underneath. After cleaning your hands, you may now put on a non-sterile glove. Apply the tourniquet 3 to 4 inches above the vein puncture site. Look for a visible, good-sized vein. Cleanse the site with 70% alcohol pad by starting from the center of the vein puncture site and working outwards, covering roughly 2 to 4 centimeters. Discard the used equipment into a sharp container. Double check that the labels and form are completely and accurately filled out. Lastly, place the collected sample into a green collection tube that then put in a plastic seal and leak-proof bag for transportation to the lab.
So to interpret the results of this test, normal bone levels vary depending on age, sex, and overall health. For adults, you have 6 to 20 milligrams per deciliter. Children, 5 to 18 milligrams per deciliter. And elderly, slightly higher levels may be normal due to reduced kidney function with age. Normal results indicate healthy kidney function and normal protein metabolism. High bone levels causes dehydration, kidney disease, high protein intake, heart failure. Low bone levels causes liver disease, malnutrition, or overhydration. What's the significance of this?
If a patient shows signs of kidney damage, diabetes, or high blood pressure, then a doctor will want to evaluate the function of his or her kidneys. If a patient is receiving hemodialysis or peritoneal dialysis, then a bone test is done to determine how effective treatment is.
Any other tests, guys?
So because of swelling, fatigue, and possible kidney impairment, we ordered a creatinine test. This is a more specific indicator of kidney filtration.
How do you prepare the patient for this test?
A creatinine blood test doesn't require much preparation. Fasting isn't necessary. The patient can and should eat and drink the same as they normally do to get an accurate result.
How do you handle the samples for this test?
A creatinine test sample is handled by collecting blood in a plain red top or heparin tube, allowing it to clot if serum is needed. Then centrifuging to separate the serum from the cells. The sample must be properly labeled and kept at a cool 2 to 8 degrees Celsius if not tested right away to prevent deterioration. From urine creatinine, a 24-hour sample is collected, kept refrigerated during the entire collection period, mixed well after completion, and a portion is taken for testing.
So to interpret the results of this test, normal creatinine levels from males normally range from 0.7 to 1.3 milligrams per deciliter, and for females 0.6 to 1.1 milligrams per deciliter. High values indicate impaired kidney filtration. Can someone explain how this test is carried out?
The process of collecting a blood sample for this test is done just as the bone test. So the same steps would be replicated. And there are two types of creatinine tests. So firstly, you can do a blood test or a urine test. Now for the blood test, this is the most common method. A healthcare provider will take a blood sample to measure the level of creatinine in your blood, which indicates how well your kidneys are functioning. And as it relates to the urine test, this can be a single urine sample or a 24-hour urine collection. This urine test measures the amount of creatinine being excreted, providing additional information about the kidney's function.
And the significance?
This test is done often to check kidney disease if you have diabetes, high blood pressure, or other conditions that raise the risk of kidney disease. It is also used to find out if a person with existing kidney disease is getting worse, or to track how well treatment is working.
Any other tests?
The patient also complained of joint discomfort and flank pain. The symptoms suggest gout or kidney stones, so we ordered an uric acid test. For serum uric acid, blood is collected, allowed to clot, centrifuged, and mixed with uricase reagent. Urinary uric acid may use a 24-hour urine sample. Both are analyzed with spectrophotometry.
How do you prepare the patient for this test?
Firstly, patients must fast for 6 to 8 hours. Avoid eating foods that are high in purine, such as organ meats, seafood, and beer, for at least 24 hours before the test is done. Avoid taking certain medications, such as diuretics and aspirin, that can affect the uric acid levels unless instructed to do so by a healthcare professional.
The interpretation of the uric acid test. So high uric acid may indicate gout, kidney disease, kidney stones, or metabolic issues. Low uric acid may suggest liver disease or malnutrition. What's the significance of this test?
This test measures the amount of uric acid in a sample of your blood or urine. Uric acid is a normal waste product that your body makes when it breaks down chemicals called purines. Purines come from your cells when they die. Purines are also found in many foods and beverages.
Since both bun and creatinine were elevated, we calculated the bun to creatinine ratio to help determine the underlying cause. The normal ratio is 10 to 1 to 20 to 1. High ratio suggests dehydration or GI bleeding. Low ratio suggests liver disease. A normal ratio with high levels suggests intrinsic kidney damage.
So I agree with all your tests, and to give you some recommendations, you can do a repeat renal panel, kidney ultrasound, hydration, avoid nephrotoxic drugs, monitor blood pressure.